Commissioner for Department of Human Services. And only thing I can say is wow. That was some very rich discussion that was had. My staff, I was looking at the facial expressions of my staff who were here, and they were saying the same thing, wow, absolutely amazing. And the reason why I brought so many staff members, and Stephanie, you can blame me for the crowd, is because I wanted our staff members to really hear from people from leaders around the state who are concerned about Georgia's children. And so that is the reason why you have so many of our DFCS staff here, and that is the reason why I have some of the DHS staff here, is so that they can hear this conversation, they can hear this rich discussion, and they can hear the concern that you have as a leader in our great state about child welfare. So I'm going to start off, and I'm going to yield to Dr. Hill, who's going to do most of the talking. But I just want to give a quick overview about our agency so that you have some perspective about DHS. DHS is not just DFCS, but it composes and comprises of other organizations. You know, one of the things that, and this vision, mission, and core values were here long before I got here. But one of the things that really comes out of this is a couple things. Certainly on the vision, stronger families for a stronger Georgia, we talked about that. But also the independence, self-sufficiency, work, and safety of our children and adults. One of the things that I talked with the group today, and I was telling them, we deal with the most vulnerable people in our state and our agency. We deal with the most vulnerable people in our agency. So going to the next slide, you'll see the profile of the Department of Human Services, which is quite interesting. I asked the Division of Aging folks to be here, and we have Barbara here representing the Division of Aging. And you may ask, well, why are you talking about Division of Aging? Because they have an integral role with child welfare. So how do they have an integral role with child welfare? Well, they have an integral role because they have grandparents. And we have grandparents who are raising grandchildren. And so as we look at child welfare, let's not just look at it through the lens of defects, let's look at it holistically. We deal with people from cradle to grave. And certainly in our Division of Aging Services, we have a group of people who are concerned, who have resources that are aimed toward our elderly population, and so they deal with those grandparents who are raising grandchildren. Then you may ask, well, what about Division of Child Support Services that we have up here? You see Division of Child Support Services, well, they deal with the foster kids as far as foster parents. Not foster parents, but for non-custodial parents and custodial parents collecting child support. And not only collecting the child support from foster parents, but the collection of child support, period, to ensure that we have families that are self-sufficient. Additionally, they have another program that is really interesting and one that I really love is dealing with fatherhood, because we have a contingency that deals with those fathers trying to help them become better parents. So as we look at child welfare from Division of Aging to child support, you see that we run the whole spectrum. And then of course we have DFCS. You see the numbers up here, and I won't go over the numbers, but you see the number of people that we work with across the state. We're with almost 2 million people, over 2 million people in our state. So that's 1/5 of the population are touched by our agency, either through Division of Aging, through Division of Child Support Services, or Division of Family and Children Services. So we have enormous resources, and as you all think about the recommendations and all the different types of suggestions that you may have, let's think of it not just in terms of defects, but look at the agency as a whole and all the resources that we can bring to bear. Now, before I turn over to Dr. Hill, one of the things that Dr. Hill said to me when we first came on as, when she was first appointed as the defects director, she said, you know, Commissioner, she said, these are our kids. The kids that come into our custody, care, and oversight, they are our kids. And so we have to do everything humanly possible to help those individuals level the playing field so that they can be self-sufficient and so they can be independent and so they can be successful in life, just as you would want your child to be and I would want my child to be. And so without further ado, I'm gonna have Dr. Hill come up and she's gonna talk to you about what we're doing in DFCS. And we have some very, very exciting initiatives that I really want you all to take hold of and see how we can improve. And certainly Melissa did a fantastic job of talking about the child welfare system. But I want you to know that we understand that we have some areas to improve, and we need your help. And this is a public-private partnership that we're looking for throughout the state to help us improve our child welfare system.
Thank you, Commissioner. Again, good afternoon. I'm Sharon Hill. I am the Director of Georgia DFCS, and I have been the Director since August of 2013. However, I've been with DFCS since June of 2005, so I'm moving into my 9th year. I've been in several other capacities. Shortly before this, I was the Director of Federal Regulations and Data. So data, I love, and you will get to see a little bit more of it. I appreciate all of you for your commitment and dedication to this work, and I look forward to working closely with the council. As Melissa was going through, you all were asking some really good questions. I want to make sure that you all know that our data system is really advanced and to the point that we can answer most questions that you have, particularly very finite kinds of questions about factors, things, and all of that. So as you all are doing your work, keep that in mind, that you all can give us a set of questions and we can run the data for the answers. So as I get started, I'm going to just hit briefly on the organization of DFCS and go through just a bit more data. The data that Melissa presented is part of the data that we submit to the federal government. DFCS must submit our data regarding children in foster care as well as some other abuse neglect information at least twice a year. So her data was ending September 30th, 2013. So I'll be presenting some information that ends, most of it March 30, the end of March, and some April data. And then, as the Commissioner mentioned, I want to talk a bit about some of the strategies and initiatives that we have going on, some that you all have already mentioned and asked some questions about. So this is a DFCS organizational chart, and each of you should have this in front of you, yours. And so you have the chart there. Again, I'm the director, and Carol Christopher, if she stand real quick, is the division director, the deputy director. Prior to this, she was a regional director. And in a moment, I'll show you our regions, because we are divided into 15 regions. We have county directors that report directly to regional directors. And Carol Christopher had been in that position for quite a few years. This is the regions. As the regional directors were introducing themselves earlier, they mentioned, their area of responsibility. So I've listed here for you all the names of each regional director. I had to make a note. Region 6, Robert Brown, retired on yesterday. So as we speak, that one is vacant, but we hope to have filled really soon. So again, you can see the clusterings. We have probably just over 120 county directors. There are county directors that are responsible for more than one county because of the size of the county. But county directors report to the regional director, and the regional director report to Senator Jeff Lukich is the director of field operations. So he has the responsibility for managing the day-to-day operations of the whole state as it relates to both child welfare and some of the Office of Family Independence, which is our food stamps, TANF, and Medicaid. But all of the regional directors report to Jeff Lukich. And as we move on, I can provide you all with the phone numbers and email addresses of these individuals in the event you have a question or need to contact one of them. Okay. And before we talk about the data again, I want to mention a couple of things about the data that we collect. We have both administrative data and qualitative data. So, and I think back to a question Senator Millar asked about outcomes and how people were doing. We collect administrative data, meaning that we can tell you the numbers. What percent of children were in a stable placement, meaning, and I think as Melissa showed, about 80% of our children had 2 or less placements during the 12-month period. So that's the administrative data, just giving you the numbers, which is what we report out on a lot. But we also do case reviews, and we have what we call qualitative data. So for measures such as placement stability, I have a quality assurance team that each month pulls a sample of cases to review. They go out to the county offices, go through the case files. They also do interviews with the case managers, supervisors. They contact the foster parents, speak with the children in those cases to get what we call more qualitative information. So therefore, there will be times when you see two different numbers reported for the same thing. So for instance, we may have an 80% reported for placement stability from an administrative perspective. However, when my team goes out to read the cases, the placement stability measure you may see may be about 60%. And that's because as they're reviewing the case, they are making decisions about, was this a good or bad placement change? Because there are some placement changes that happens that's good. For instance, congregate care, as Judge Walker also mentioned, that it is our desire to have children in a family-like setting as much as possible. But again, in this state, we have about 17% of our children are in congregate care or group home facilities. So we do know that it is a necessity. But there are times when if a child moves from a congregate care to a foster home setting, in our data that pretty much counts against us from an administrative perspective, but when we go out to do a qualitative review, it would not, because that would be a good thing to move a child, what we call stepping them down. Same thing within congregate care settings, we have things such as maximum watchful oversight, meaning that this is a child that really requires a high level of supervision and some issues. So we may bring them down. They may still be in a group home setting, but not one that would be as restrictive as that one. Also, they are looking at things such as, they may talk to a foster parent and say, why did this child move? And foster parent may say something like, I have been contacting the case manager several times. Nobody came out, and after a while I just got tired and said, move the child. So we are able to dig down into that degree to determine what is the real story behind some of the numbers. So we do publish both sets. We report on what our qualitative review record said as well as the administrative data. The other thing, again, with the data, Melissa provided some data around CPS intakes and that increase. And again, this shows kind of a monthly view to give you an idea of what has gone on in the past year. So this trend is showing from March 2013 through March 2014. And you can see the jump in the number of intakes that we have received over that time period. Let me say that about probably 35, almost 40% of the intakes that we receive, intakes, reports of abuse or neglect, come from the school system. So what's going on with the school system certainly impacts this. So for instance, March has always tended to be a fairly high year. We see an uptake there. And we know that in March, there are some schools that starts to do some testing. Kids have gone home for a week for spring break and come back to school. Then sometimes we'll see an increase around May. Right before school is out, we generally see more intakes, because teachers are concerned about what's going to happen during the summer. They may contact us. Then you can see June, July, it really drops. So again, that's the impact of teachers reporting. And so you see how critical teachers are to the process. Then we start to see the uptake again toward the end of August, September, when school comes back in.